Suicide is the song you write for yourself. You write it, you play it, you live it, you imagine the response of the crowd, but it's one performance only. Welcome to Blue Club. My name's John Schumann. I'm with my friend Dr. Nick Ford, and we're going to have a chat about a difficult topic, and that's suicide. Nick, 65,000 attempts a year. 3,000 Australians lose their lives to suicide. 9 per day. 80% of them are men. The leading cause of death for people between the ages of 15 and 45. Shocking.
Those are big numbers.
They are big numbers. Interestingly, I looked at the Beyond Blue report a couple of years ago, and they said that the rate of suicide among cops is less than the general population, but frighteningly, cops are 3 times more likely to have a suicide plan.
It is lower than among the general population, but here's the thing. Your coppers are handpicked to be above the general population in terms of resilience, intelligence and aptitude. This is not a population that you would expect to have a suicide rate the same as the general population.
But why would you expect them to have a suicide plan? That's frightening. 3 times more likely.
I think it reflects the idea that depression, anxiety are actually elevated in cops, that they actually thinking their way through it as to where things might go. The other thing is sometimes that suicide plan can be seen as an exit route. If things get too bad, this is where I might go.
If you haven't stood on the edge and looked into the blackness, you can't understand suicide. Why do people do it?
There's a whole bunch of factors. I guess the big four, despair, that sense of hopelessness, strong feelings of anger, impulsivity, and alcohol mixed with those things is really lethal.
Untreated mental illness?
Absolutely. Untreated mental illness, and those are the factors that we're really looking for when we're assessing suicide risk. Despair, impulsivity, anger, and if there's alcohol involved, that's a factor. We also need to think about means, the availability of means.
You talk about anger. I mean, is a suicide attempt an expression of that anger, trying to get back at something or the world?
Sometimes. Sometimes that, what the analysts call retroflex murder, of showing somebody how much you're angry with them is part of a suicide attempt, but not always. One feeling, a really tragic one, is that you're a burden to others, that they'd be better off without you and you need to get yourself out of the way. The thing about suicide is it's like throwing a boulder into a pond. The ripples spread everywhere and they're quite devastating. Family and friends, everybody's affected. The other is that feeling of hopelessness, that it is actually despair. There is no benefit. That suffering is so intense that somebody wants to be alleviated from that suffering, and that's where death comes in.
Are you able to say, I mean, is it true to say that somebody who is thinking about suicide or attempts suicide doesn't necessarily want to stop living, they just want the pain to stop?
Absolutely. Absolutely.
Cops and access to guns. Let's just have a look at this.
I'd have to say you're almost looking good. I mean, almost, not quite.
Almost.
Yeah, almost.
Thank you.
You're welcome. That's what I'm here for. Yeah. No more greys. Must have done you good, eh?
Should we be trusting him with a loaded weapon?
Speak to John, mate.
You got put to work, didn't you?
Oh, just a bit around the garden, a bit of painting, but...
Oh, yeah.
Got
How's the bike?
So, should we be sending him out on patrol with a loaded weapon? He's been a bit on edge lately.
I'll keep an eye on it.
Thanks, sir.
Yeah, you still inviting Uncle John over? Or is...
So, to what extent do you think ease of access to firearms on the part of a cop is dangerous in terms of potential suicides?
Tackle that in two ways. Suicide attempts fail sometimes because the method chosen allows intervention to occur. This is particularly so for overdoses, not so for hanging. Suicide attempt with a weapon is going to be fatal. Police weapons are usually supervised, usually locked up, and usually under control. It's not a major issue in itself. Having said that, I've seen individuals who've been really depressed and it hasn't been picked up, it hasn't been dealt with in anywhere near approaching a proper way, who've at least speculated about shooting themselves at work. Now, obviously, we've taken those person off duties, entered them into treatment, etc.
Look, there are a lot of myths about suicide out there at large in society. I'm going to throw some myths at you, and I'd like you to respond. Okay. If you talk about suicide, you're not serious about it.
Nah. If you're talking about suicide, you are thinking about it. The trick is that the people who talk about suicide very often don't say it a lot. So the comments about suicide are often very subtle and often noticed in retrospect. We need to take suicidal threats seriously, but we also need to be careful that we've actually heard that suicidal threat.
Suicides happen without warning.
There is nearly always a build-up. Sometimes the indicators are subtle. We're looking at withdrawal from others. We're looking at statements of personal failure or personal inadequacy. Sometimes there are obvious triggers, criminal charges, major losses, failures of romantic relationships, all sorts.
Yeah, we'll get to more of those. What about the view that if you're going to commit suicide, you're going to commit suicide and nothing or nobody can stop you?
Nuts, in a nutshell. If the patient with suicidal ideation is picked up and we can identify and treat the mental illness, I'm not saying we turn it around 100%, but the results of treatment are pretty darn good.
Don't talk about suicide to a suicidal person, it only encourages them.
Again, absolutely not. Talking about suicide, identifying as a factor, identifying as a risk, talking about the reasons for living, and then finding access to treatment or identifying the problem is a way forward.
If you suspected that somebody you knew was thinking about suicide, how would you approach the conversation?
I guess as a clinician, it's expected that I'm going to ask, so I'm pretty direct about it. Sometimes things get so bad in a situation that people think about suicide. How's that going for you? So I'm pretty direct about it.
But somebody like me, I'm not a clinician, but I'm frightened that a family member or a friend.
Then it will usually be a much more leisurely build-up. You don't seem yourself. You seem to be cutting off from stuff. I wonder if you're depressed. Look, sometimes when people get depressed, they start thinking about suicide. Is that something that's on your mind? So it's probably about a 4 or 5 question lead-in, which as a clinician I can usually jump ahead from.
Okay, there is the view that, only a psychiatrist can stop somebody committing suicide.
We do help.
Yeah, but the question is only a psychiatrist. Is that true?
No. I think that getting people into psychiatric treatment, getting people into psychological treatment or even their GP is a way forward.
Okay.
Support, consideration from others are one of the really healing and helpful things that we can do with people.
Family and friends.
Yeah.
Okay. I've heard that suicide runs in the family. True or false?
Absolutely true. Now, one of the things about that is suicide and mood disorders run in families, but it's probably not the mood disorder that's running in the family. It is a tendency for a perfectionistic personality, a person who's empathic and kind, usually of above average intelligence. These are beneficial traits. These are great things to have. Unfortunately, if life goes playing mean tricks on you, then the tendency to depression will be elicited. So what you've got is a thing that's being inherited, which is a massive benefit, but carries this vulnerability to mood disorders.
A suicide precipitates copycats, true or false?
Can happen, absolutely. One of the things that's spoken about when suicide is spoken about these days is a reference of organisations to contact. Now, that work about suicide spreading from reference to it, one of my great mentors, Professor Bob Goldney, was able to identify that 20 or 30 years ago, and I think has had a lot to do with being aware of that and making sure it's publicised in the media.
Okay, I want to talk about, the signs and symptoms that those of us who are not clinicians can pick up ourselves in friends and family members that we're worried about. Suicidal threats, self-harm, is that something to watch out for?
I guess even rolling back from that, you're looking at somebody, perhaps there's been a major life reversal. The next thing you'll see is the withdrawal, maybe changes in appetite, changes in sleep, increasing irritability, increasing anger, increasing alcohol use, and then you have the suicidal threats and self-harm. So there's a range of responses in depth. By the time you get into suicidal threats, and self-harm, you're really looking at a pickly situation.
There is a view out there that if somebody is preoccupied with themes of death, either music, death metal, gothic sort of art, movies about death, that can be some kind of indication. Is that true?
Probably not. I guess if there's a change and there's a preoccupation with some of those things abruptly, then that can be a sign that somebody's despairing. But in itself, a lot of that music and a lot of that art, Leonard Cohen songs, some heavy metal bands, they're not signs in itself.
Let's have a look at a clip from Dark Blue. Oh, shit.
Jesus, no. Oh, God.
The number you have called is either out of range or has been disconnected. Please ring.
Hey, John.
Karen, look, is Grant home with you?
I just had to get the kids out of there. I'm at my mum's at the moment.
No, look, I want you to go home and check to see if he's there, will you? And give me a call back, will you? Why? No, don't argue with me. Just go and do it now. It's urgent.
What do you mean?
Nick, there is a sort of a sense out there that if somebody's giving away prized possessions or making arrangements or final goodbyes, is that a sign?
Yeah, that's a really gnarly one. When you have somebody who's been through a tough time, behaviour's changed, they're withdrawn, isolated, and suddenly things seem to pick up. They're making plans, not always for the future. They're getting things organised. Maybe they're ringing people up to apologise for past transgressions. That's a sign that something pretty bad could be about to go down. But by then, you've got days, maybe even sometimes hours.
Okay. Have a look at this one.
Karen, please forgive me. But this is the best that I can do for you. I'm sorry for not being good enough, and for not being the father that our kids deserve. I thought I was strong enough to help everyone, but turns out that I'm not. You deserve more than to be burdened with me. Sorry I couldn't be more. I love you.
Somebody who is really thinking very seriously about suicide, as in the case with Grant there, there's an apology for being a burden, a feeling of self-worth, like you haven't actually delivered to those around you that you love, that you want to deliver to. Is that common?
Yeah, absolutely. There are those who suicide who are full of anger and hurt at perceived rejections or perceived wrongs. Feeling a burden to others, convincing yourself that the world would be better off without you, that's very common and very tragic. So he said a couple of things there. He's apologised. He's reflected himself of no value. The fact that he's going to the trouble to write a note is also a bad sign. So if you have somebody in hospital who's survived their suicide attempt and you're seeing notes being written, then that's a flag that this is something that is really serious and maybe you're looking at a period of hospitalisation.
What about risk-taking?
It was worked out in South Australia. I think that 2 or 1 in 10 solo car accidents are actually suicide attempts. Sometimes people will deliberately take risks to make the next things happen faster, to see if it can be gotten over with. And one of the things they're thinking about then is if it's an accident, maybe there'll be an insurance for the parents, for the family and friends. Maybe it will look like an accident and they won't have the other people feeling guilty.
There would be honour in a single car accident.
There can be honour in a single car accident or risk-taking. The great mountain climber Chris Bonington, who was accused of being suicidal, observed that he wasn't suicidal, that they take more precautions than the average suicide. So risk-taking without precautions.
I want to get back to the significant mood upswing. Yeah. So if you've got a friend or a family who's been very black for quite some time and there is a significant mood upswing, do you relax and think, oh, good, we're through that? Or is that a serious red flag?
That's a serious red flag, and that is something that the question should be about. Are you really okay? No, you can't monitor somebody 24 hours, or mostly you can't. But that is the type of thing where you're checking in, every 6 or 8 hours or so. Are you okay? Keeping an eye on the person, saying, let's go out and go to the library, don't go to the pub. Go somewhere, just keeping an eye on the person, but at least unobtrusively.
To what extent does alcohol play a part in suicide attempts?
Yeah, look, it's something that comes up really commonly. It's a way of getting a little bit of euphoria, although after 2 or 3 drinks, alcohol becomes a depressant, so it encourages that depressed mood. It's a little bit analgesic because people are frightened of suicide, frightened of the pain that might be involved, so they're keen to step away from that. The other thing is it diminishes impulse control. So a person who might go backwards and forwards about it when they're intoxicated will actually take that next step.
Okay, so we touched on this before. If someone is thinking of suicide, what do you do?
You keep in touch with them. You keep contacting them, you're sending them texts, you're reassuring them, you're just keeping an eye around them.
But isn't that a bit bland? I mean, if, I was just thinking, if I had a friend who I really thought was serious about suiciding, I would probably want to do a little bit more and be a little bit more proactive than just send him a text and say, how you going? Are you okay?
And while you're doing that, you're continuing to nag them. I think you need some professional help. You need to see your GP. We need to go to a hospital casualty. Now, the trick about that is that patients who are depressed will usually do none of those things. So sometimes very often you have to make the appointment for them. It's not uncommon for patients to be brought along to their GP by a friend or a family member and telling the GP, look, you know, so-and-so is really depressed. I dragged him along to see you. See the word dragged? Dragged him along to come and see you because I'm really worried about it. And then the GP will conduct that assessment. Now, mental health services can be pretty good at dealing with these things. Sometimes they can be a little bit dismissive. But that word dragged is a useful one.
Do you ask somebody directly? Are you thinking of suicide?
In my clinical practice,
Well, no, like me. Like as a lay person.
yeah, look, I think we roll back to that in that 4 or 5 stage questioning. Look, you seem a bit out of sorts. Haven't been hearing much from you lately. You seem a bit cranky. Is everything okay with you? You're not looking so great. Look, you know, people in that frame of mind, they start thinking about suicide. Are you okay with all this? So building it up to it over that 4 or 5 question period is the way forward.
I remember when Michael Hutchins died.
Yep.
And I was approached by some people from the media and asked had I had suicidal thoughts myself as a musician. And I remember reflecting and thinking to myself, you know what, I reckon if you're a musician at a certain level and you're alone in a hotel room in a strange city, away from your loved ones, there might be sort of relationship tensions, career issues. I reckon if suicide hasn't crossed your mind, you're lying.
Quite possibly so.
So that's a lead up to this question. How common are suicidal thoughts, and would you say to somebody who you suspect might be suicidal, would you reassure them that these thoughts are quite common?
They are quite common to an extent. I think of one person who will attempt suicide, about 10 or 15 will have suicidal thoughts. So as a predictor, it's reliable, but not 100%. But here's the thing, rolling back to, say, the musician in the hotel room who's isolated. So how come he's isolated? How come he hasn't formed a plan to deal with being alone in a strange city, which I'm sure he's done hundreds of times before? How come he's in that situation where his mood is collapsing in? People can and do find ways of dealing with dodgy situations, but when your brain is gearing towards suicidal thoughts, that's a suggestion there's something else going on.
Okay, so you're worried about somebody, family, friend, workmate. You've worked with them. You've engaged. It'd be fairly traumatic, I would think. I reckon there would be a high level of anxiety if you're trying to support somebody who's suicidal. What about you? If the person either suicides or doesn't, I would imagine that there's a fair bit of tension and anxiety. How do you look after yourself in this situation?
Huge amount of tension and anxiety. And I'll get back to the most important thing possibly last. The first thing is, I guess, during that period, that acute period of entrance into treatment and treatment starting to work, you're going to be riding the storm. It's going to be a tough time. The vigilance is going to have to be increased. I vividly recall a patient who had a call from the wife to say this guy has disappeared, 3 or 4 hours disappeared. It turned out he was doing something benign and innocuous, but everybody in the treatment team went absolutely ballistic. So, it's kind of like waiting for the German bombers to come in England during the Second World War. You are on tenterhooks. That period of time will be over, and then there's the need for rest, relaxation, the usual kind of stuff. One of the things that comes up with suicide, it is the ultimate form of rejection. So
What do you mean?
Here's your loved one or family member or bestest friend who you know has been thinking about suicide or has attempted suicide or, God forbid, has committed suicide. Now, it's not meant as a rejection, it's meant as an expression of despair, but it's really hard to feel that somebody you thought was you were close to really is rejecting you by dying. Now that creates feelings of uncertainty, it creates feelings of anger, it creates lots of feelings of mistrust, and those feelings are going to swirl around the head of somebody who's been dealing with a suicidal person.
So what do you do to look after yourself?
In that situation, reflecting on the feelings, talking it over, seeking reassurance from the people treating them, and then the usual stuff about mental health, making sure you get enough sleep, exercise, distraction. I guess one of the principal things is seeing this as something that's taken over the brain of the person that you love, that this is, you know, it's said the earliest diagnostic manual for psychiatry had two categories, possessed and not possessed. And in a way, you can kind of see this almost as a form of possession, hokey as that sounds, that person's brain has been taken over by something that is dark and making them think like that. You're not talking to the normal person that you're talking to. You're not, the person that you love and value is for that period of time was no longer there.
So, okay, so you find somebody to talk to that you trust, to sort of debrief with. You do the usual things, you know, you look after your diet, you get some sleep, you do some exercise. Still no better. What then?
So if you've been dealing with somebody who's really had a significant mental illness and you're really suffering from it, then I guess you're going to need some professional help. One of the patterns that I've seen on a few occasions is somebody who's been seriously mentally ill over usually a period of time, and we get recovery. Then we see the husband or the wife of that person also decompensate.
Okay. I just want to go back to a word that you used a few moments ago, distraction.
Yeah.
You talked about diet, exercise, you know, sleep and distraction. What do you mean by distraction?
I like benchmarks. Everyone's got things that they do that make them feel better. And it helps to be able to just give yourself time to do something else, for your brain to process what's happened and usually pop out with a better solution that you've had. The solution that you've had might be to isolate yourself, hit the grog, go and yell at the person who's attempted suicide. Not adaptive outcomes. With a period of distraction, with a period of doing something else where there's a sense of success and reward, is valuable. And everybody's got different patterns. Some people like to solve quadratic equations. Some people like to play video games. Everybody's got different ones.
Some people like to prune roses.
Shoveling gravel is something that I've found useful.
Okay.
It's very hard to make a mistake shoveling gravel.
So, impact on family and friends?
Huge. Completed suicide is a rejection. Plus, it's a loss of somebody that you loved, cared about deeply, and that person is gone. Furthermore, there's a savagery about it. There's a rejection that goes with it. And the other thing that comes up is, how could I have helped? What could I do differently? Sometimes there are things that are missed. Sometimes there's nothing that could be done. Very rarely. I've done a number of audits for the coroner. I remember one of the most tragic was where everybody in the team, including the family, had done everything right and they were unable to save this kid in this particular instance. But there will be that second guessing. Sometimes you just can't stop it.
Okay, to finish off with...
But you can certainly minimise the rate at which it occurs. And just to finish on that, there has been a decline in the suicide rate in Australia over the past 30, 40 years, which is encouraging.
Okay, to finish off, if you were having a conversation with somebody who was seriously suicidal,
Yep.
what would you say to them?
It's a permanent solution to a temporary problem. People are going to be massively affected by this. There is something we can do about it.
Okay.
Safety is an issue. Sometimes we put people in hospital. Sometimes we even detain them under the Mental Health Act. Usually you can build, well, very often I'm able to build a relationship with patients. and persuade them to remain in hospital. I've got to say, getting access to psychiatrists can be very difficult. I know in this state there's about 12 or 15 psychiatrists who seem to do all the acute work. So a lot of the GPs are left to manage this and they do a very good job, but there needs to be better access.
Well, what do the other psychiatrists do?
Gee, I don't know.
Right.
Not much, I suspect.
Yeah, okay. Look, if you're watching this and you're battling, remember it's not a sign of weakness to reach out for help. It's a sign of strength. Look at the sky. There is beauty in good weather. There's beauty in bad weather. You are a boat. You are not the storm.
I joined the force about the same time Grant did.
There's nothing you can do, sweet.
Grant.
Coffee? No. Should we be trusting him with a loaded weapon? He's been a bit on edge lately.
Shut your mouth. I'm trying to get this under control here.
Don't talk to me like...
I now need you to come back to the police station.
Fucking jacket, you idiot!
You're a risk, Grant. You're a risk to yourself and everyone around you.
It was dark, mate. Anyone could have made the same mistake. It's what I wrote in my report. Grant! They never said it would be like this.